Good evening, and thank you for joining tonight's telephone town hall meeting hosted by Jefferson County Public Health. I'm Roger, and I'll be your moderator tonight as we discuss the current situation around the COVID-19 pandemic and what comes next for the Jefferson County community. Our presenters this evening include Dr. Mark Johnson, Jefferson County Public Health's Executive Director, Kristine Billings, Incident Commander at Jefferson County Public Health, Libby Szabo, Jefferson County Board of County Commissioners, Mary Berg, Director of Jefferson County Human Services, Kat Douglas, Director of the Community and Workforce Development Division through Human Services, and Amy Miller, Senior Services Manager at Jefferson Center. That is an all-star lineup tonight. Before we begin, I want to take just a moment to tell you about the format for tonight's interactive call. We realize that some on the call will just want to listen in, but for those that want to ask a question, please press *3 on your telephone, and you'll be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until it's your turn. So go ahead and press *3 now if you already know your question, and this is the same process to follow throughout the call. If you hear something that sparks a question, just press *3 and you'll get directed to our operators. Since we'd like to get to as many questions as possible, we'll ask you to limit yourself to just one question, and when it's your turn, I'll call your name and ask you to repeat your question for our live audience. So let's get started. I'd like to turn the call over to Dr. Mark Johnson for some opening remarks. Doctor, go ahead.
Thank you, and thank you all very much for joining us for today's call and spending part of your evening with us. We know that the last several months have been unprecedented and difficult for everyone in many different ways, including mental and physical health challenges and very real economic and social difficulties. On this call, we hope to provide you with an update as to where we currently are in response to this situation, what comes next, and what resources are available to support you during this time. I want to start off by providing a brief update on the COVID-19 situation in Jefferson County. As of 3 o'clock this afternoon, we have had 2,477 cases of COVID-19 in Jefferson County. Unfortunately, 162 Jefferson County residents have died from this virus. Jefferson County Public Health has been working diligently with the Centers for Disease Control and Prevention, the Colorado Department of Public Health and Environment, the Jefferson County Sheriff's Office of Emergency Management, and many, many other partners, including those on the call tonight, across the county to stop the spread of COVID-19. We've been implementing policies such as the state's Safer at Home order to ensure that our community is continuing to protect one another and follow important disease control methods such as social distancing. We've been working to ensure we have enough personal protective equipment for our healthcare workers and others on the front lines. We've been conducting investigations around positive cases and expanding our capacity for doing contact tracing. We've been supporting our community partners in meeting basic human needs of our community, such as access to food, housing, child care, and mental health supports. We've been supporting community health care partners in expanding testing capacity, including our local community testing site at Stride Health Clinic in Wheat Ridge. We've been keeping our community and partners informed in many ways to stay healthy and giving them the latest information that we have. I'd like now to provide some updates into the next phase of our response and our community guidance around COVID-19. As you probably recall, we began with a stay-at-home order and then transitioned into a safer-at-home order. Under the safer-at-home level, which we still are under, we aim to slowly reopen our communities while also maintaining strict precautions to help people keep safe. Under the safer-at-home, I would remind you that the guidance is you are encouraged to stay home whenever possible. You're urged to wear face coverings whenever you're out in public. You're encouraged to limit your travel and to limit your travel for recreational purposes to within the county or within 10 miles of your home. Many of our businesses have been operating with precautions these past couple of weeks. On Monday, the state announced that Colorado restaurants can begin to reopen with precautions beginning today, May 27. This includes important steps that both businesses and customers must take to limit group size, maintain physical distancing, and ensure proper hygiene. Additionally, private campsites are permitted to open beginning May 25, and children's day camps and youth sports camps can open on June 1st. Guidance for these new openings is available on Colorado Department of Public Health and Environment's website and at www.jeffco.us/safer-at-home. While this new normal has been present for what feels like far too long already, these are the kinds of slow, strategic steps we should expect as we move forward and as we prepare for the long haul. We can expect that COVID-19 is going to be a part of our lives for the foreseeable future. That doesn't mean there aren't ways we can adjust to this, though, and continue to move forward. I'd like to welcome Kristine Billings, our incident commander now, to discuss the recovery phase of this pandemic and how we can be resilient. Kristine?
Thank you, Dr. Johnson. Hello, everyone. My name is Kristine Billings, and I am the Incident Commander for Jefferson County Public Health for the response to COVID-19, as well as our Emergency Preparedness and Response Coordinator for the county. Just a reminder, we will be taking questions at multiple points throughout this call. To ask a question, please press *3 on your telephone keypad, and you will be transferred to a screener. While we are not there yet, we are looking ahead to an important phase of response to this emergency, and that is recovery. What that means is we want to look at how to phase things back in a different level to eventually get closer to where we were before COVID-19. A big piece of recovery is building on the resiliency that already greatly exists among Jefferson County residents. Resiliency is the ability of communities to rebound, positively adapt to, or thrive amidst changing conditions or challenges, including public health emergencies. The goal is to maintain quality of life, healthy growth, economic vitality, and conservation of resources for current and future generations. And we know our community can do it. If we look at our past, we've overcome other emergencies like major floods, of course wildfires, and the H1N1 2009 pandemic, to name a few. So what does this look like for us as we move from aggressively responding to COVID-19 to eventually becoming more resilient in its wake? It means being flexible and adaptable, taking small steps to reopen like we have with Safer at Home, while carefully monitoring health impacts and adjusting as needed. It means working collaboratively in partnership with businesses and organizations to make some changes around how services operate. And it means listening to our residents and vulnerable populations, constantly taking feedback and focusing on responding to unique local needs. And everything we learn now will take with us moving forward. We are all interconnected. And if we approach the next phase of this response as a team effort to rebuild based upon what we've learned, we will come back stronger and be more resilient for whatever changes come next. As we move forward, I urge each of you to think about your role and what you play in helping our community bounce back. Continue to be vigilant about your personal efforts, such as staying home as much as possible, limiting group exposure, and wearing face coverings in public. We can continue to move along this spectrum of recovery, and eventually we will all get through this. I'd like to take a moment now to hand it back to Roger, and we'll take some questions.
All right. Thank you, Dr. Johnson and Kristine. Let's take some questions. As a reminder, you can participate in the discussion by pressing *3 on your keypad. You'll be transferred to an operator who will take down some basic information and get you in the queue. So again, that's *3 on your phone to ask a question. Here we go. We're going to start off with Sue. Sue, you're live. Go ahead.
Hi, Mr. Johnson. Thank you so much for having these town hall meetings. It really is very helpful for us. I am a resident of Evergreen. I'm 63 years old, and I have numerous vulnerabilities, some very serious ones. My primary care doctor and my infectious disease doctor at National Jewish have both told me that if I get COVID, it will not be a good thing for me. I'm on oxygen already, and it just wouldn't be good. So I have a 20-year-old son who lives with me, and he works at Bojo's Pizza in downtown Evergreen. And thus far, I have felt relatively safe with him working there and being careful at work and wearing his mask and all of that. But last Saturday, not this past one, but the one before, my husband and I went grocery shopping. And I was absolutely horrified at how many people were in Evergreen and how many cars there was. It was bumper-to-bumper parking, shoulder-to-shoulder walking, and these people were obviously not Evergreen residents, and none of them were wearing masks, and none of them were doing social distancing. And these people are going into Bojo's Pizza where my son works, and I am literally frightened to death. I can't ask my son to quit his job. He has car payments and things like that. Is there anything that anybody can do to cut down on this? I understand that they are not supposed to travel more than 10 miles.
Sue, I'm going to jump in and so we can get everyone's questions.
Okay.
I think Dr. Johnson was going to take this per chance.
Okay.
Thank you, Sue, for your question. And you highlight an area that is of great concern to all of us in public health and in healthcare, and that is how do we protect those who are vulnerable, who do have other conditions or using oxygen or have lung disease, other things like that, which is one of the reasons, it's not the only reason, but it's one of the reasons that we have been so prescriptive as to social distancing limits and the numbers of people who can gather, the numbers of people now who can be in a restaurant at one time, and all of the guidelines that we have given to all of the businesses as to how they can do what they need to do to be economically successful, but also to protect those who work with them and their clients when they come in. Unfortunately, we do not have the power or the numbers or the resources at the health department or even with the sheriff's office to be everywhere and to be monitoring and enforcing everything at all times. And so we have turned to business owners as much as possible and to people in the community to remind those who are not social distancing to please do so because of the risks that they are putting you at, to be mindful of wearing face coverings and all of those kinds of things to try to protect not just you but to protect them because they also are at risk if they're not following the guidelines. We have been told numerous times that we can allow this the opening of the economy because we in Jeffco are Jeffco strong and will follow the guidance. I think probably 95 or more % of our population does that, but it's the few who are not following and that puts everybody at risk. And I don't know how to be more forthright with our population that what they need to do is to please be thoughtful of others and to do what they would do if they were in the same situation, if they were vulnerable, how they would want to be treated. But unfortunately, this has become a bit of an ideological fight between putting on face masks and doing social distancing and not doing it. And we're really in a very difficult period right now of trying to get people to please think of others and not just think of themselves as they do those kinds of things. So thank you for raising that issue. I hope that we can continue to let people know how important it is and that we can begin to see more people really doing the social distancing and wearing face coverings as they should as a good civic-minded resident. Thank you, Sue.
All right, thank you. Let's go to Brandy next with a question. Go ahead. Hello, Brandy.
Did you say Brandy or? Oh, hi. I thought you said Randy. I couldn't quite hear you. I'm just kind of curious. With all the information coming out daily, there was even something on Mother Jones today where they actually agreed with Senator Rand Paul about school closures being ridiculous. I'm just curious, is there any change that you see coming through with the thought to opening the schools without any of the ridiculous CDC guidelines? I have 4 students here at my house, and this is not going to work next year. And so I was just wondering what things that you have seen through the CDC guidelines that will not work in a school environment.
This is Dr. Johnson. I'll take that question, and thank you, Brandy, for the question. School closures, we are working very closely with the superintendent and his staff, who are working very closely with the Board of Education. They are the ones who will eventually put together the reopening plan. I did just today get a draft of the reopening plan for the R1 school district and am reviewing that, and we'll discuss that with the R1 district staff. You couched your comments in language that shows the division that we do have in this country right now. You can find some authority almost anywhere who can say or will say whatever you feel comfortable with what they say, and whether it's calling CDC ridiculous or calling Mother Jones and Rand Paul ridiculous, the society is pretty much split down the middle on that. What we are trying to do as we move forward and as we look at the guidelines that come from places like CDC, and as we work with the superintendent and the staff at the school, we are trying to base whatever decisions that we make or that they eventually choose on the best science that we can find, the best available way to use the resources that we do have to keep the children safe, as well as the vulnerable children who are in the schools, those who are immunocompromised, and the parents who these children eventually will go home to visit or to spend time with, or the grandparents that they live with, and also the staff and the teachers with whom they are interacting. So although it is true that children, for the most part, are not hit as hard as older folks, it's not that they cannot also spread the disease, and quite often do so asymptomatically when we don't even know that they are spreading the disease. So trying to take all of those things into consideration, we will continue to work with the superintendent and the staff at the schools to put together a reopening plan that does make sense, that is helpful to parents and to students, and that is safe both for the students and for the staff and the others around the schools. Thank you, Brandy.
All right, next is Dave. Go ahead.
Hi. I was wondering if you have a timetable for when health clubs will open, and if they will, what capacity. The place I work out is huge, and it's never, I go at all times of the day, or did. And it seems to me like there's never any more, except maybe, I guess, at 5 p.m., more than 10 to 15% capacity in there anyway. And I know it's probably not at the top of everybody's list, but it's important to some of us to be able to try to stay in shape. Thank you.
Thank you, Dave. I'll take that question too. This is Dr. Johnson. We have gotten a lot of people who have been commenting about gyms and fitness clubs and the ability to try to make sure that they can continue to work out and be in shape. The governor is scheduled to add some more changes to the Safer at Home plan on June 1st. That would be next week. I do not know what all is going to be included in that, but at the same time, the governor's office and the state health department are working on a plan to push the variance permitting process down from the state to the local health departments. That's going to be a mixed blessing and curse for us because it will increase our work, but what it will do, it will allow us, instead of just blanketly saying all gyms are closed, we will have the ability at the local level to inspect your gym, to go into the gym and say, wow, you're right, this is a huge place. Here are the guidelines that you would need to follow to make sure that people are safe here. And if we go in and there's a very small storefront gym, we can say, this is a bit small. Here are the guidelines that you may need. So the plan is that eventually that will be put down to the local level and we'll be able to make some decisions on places that are a bit more focused as to the unique needs and resources that are available at the local level. So hopefully that'll happen here within the next week or two, maybe 3. But it does look like changes will be coming fairly soon. Thanks again, Dave.
All right, next up we have a question from our Spanish simulcast, Exmora. She asks, what is Jeffco doing for people who have contracted COVID-19 and what follow-up is being done to avoid spreading the disease?
I'm going to ask Kristine to answer that. Yeah, go ahead, Kristine.
Yeah, thanks, Dr. Johnson. Thank you for the question. This is Kristine again. A few things that we are doing, and one of our biggest ones that you may have heard a lot about is called contact tracing. And contact tracing is a public health standard practice which allows us to work with a confirmed case of coronavirus. And we talk to that individual and we do an investigation and we help them recall everywhere that they've been and everyone that they've been in contact with to the best of their ability. And we look at all of the data from that investigation and we assess some risk to the exposed level of the individuals that they may have had contact with. And what we do is we then provide contact of that confirmed case with information such as education, information on testing, what they should do to quarantine themselves, and that means sort of pulling themselves away from anyone and waiting for 14 days just in case they develop symptoms of COVID-19, and that prevents further spread of the disease. One of the things with contact tracing that we definitely want people to know is that we only do contact tracing for folks that are considered cases. We do not ask the case, we don't disclose the case's information to those contacts. Sometimes they find out, sometimes they don't, but we do not, as a public health agency, disclose that case's information. We work to provide information to all of them to keep them safe. And for both those contacts and our confirmed cases, we do have a case management team that is working with them to provide them with resources that they may be needing for assistance while they are under isolation or quarantine. So that is something that the health department is doing to support all of those cases. I have seen information too asking about how deep we go, quote unquote, in contact tracing. We reach out to all of the contacts of our confirmed cases, and in doing information and gathering with those contacts, if we identify someone who is symptomatic, we then go one ring further around that symptomatic contact to see who they may have had contact with. So it definitely can lead down a very long train of people. But the idea is that we can identify them, isolate them, and protect the health of the public around them.
All right, great questions so far. Let's take a break, and we're going to go to a panel of folks who will provide some additional updates and speak to resources available to support the Jefferson County community now and throughout the recovery period. First, I will turn the call over to Commissioner Libby Szabo. Libby, go right ahead.
All right. Thank you, Roger. And good evening, everyone. I'm so glad that you joined us tonight. I just want to share a little bit about the county and talk specifically about how we are reopening to the public. The federal dollars that we received that we are sharing with the city, as well as a little bit about our budget and how it is faring during all of this. The county has continued working through all of this, even though our building and facilities have been closed. We've had so many employees that quickly transitioned to working at home to make sure the business of the county is getting done. We will actually be back opening up to the public on June 1st. We have added sneeze guards to the front desk and the following, and we are following all of the cleaning protocols to help not only protect the visitors that we have, but also our employees. We will strongly recommend that everyone in our facility adhere to social distancing recommendations and to wear a face covering while visiting us. The county received CARES Act funds from the federal government to cover expenses that are related to the coronavirus. And some of the things that the Board of County Commissioners are doing is, on May 4th, we worked very quickly to approve the distribution of these CARES Act funds to the 11 cities in the county. The cities will receive their share of the funds based on their populations. These funds will really be a great relief to the businesses and nonprofits in our community that have been struggling through the shutdown that the coronavirus has caused. The CARES Act Emergency Grant Program application process opened yesterday, and applications are being accepted through June 9th. You can find this information of how to fill out an application on the program on our website, which is www.jeffco.us/4057. I look forward to working and collaborating with all the cities to take care of and support the businesses and nonprofits that have been devastated by this pandemic. As many of you know, the county budget was already seeing some challenges before COVID-19 hit. Our budget team is working hard to forecast how these challenges may affect our general fund budgeting and the change in the coming months and years. They are assessing changes to our revenue, which typically is impacted more slowly due to most of the revenue coming from property tax, which is collected in the arrears, and not sales tax, which is immediately collected. So far, the financial picture has not changed much for 2020, but we may see more impacts in 2021 and 2022. We're keeping a close eye on how that will affect the operations of the county. Now I want to turn it over to Mary Berg, our Executive Director of Jefferson County Human Service. Take us away, Mary.
Thank you, Commissioner Szabo, and good evening, everyone. Thank you for joining us this evening. The Human Services Department, in partnership with Public Health Department, our many nonprofit agencies, and the faith community, are committed to supporting our community now and throughout the recovery process. We know that our residents, many of you, have been struggling, especially in the areas of housing, including paying the rent and having adequate access to daily food and nutrition. A great resource for support is the statewide 211 database at 211.org. we have posted on the Human Services website a Colorado Tenant's Guide to COVID-19. This guide can help renters when working with their landlords. The governor passed an executive order that limits evictions and foreclosures during this time, and also authorizes the Colorado Department of Local Affairs to make funds available for rental assistance. In addition to this, on the Jeffco Community Resources webpage at www.jeffco.us/community-resources will assist you in locating a number of different areas to find rental assistance, access to meals through our school sites, and resources specifically for seniors through our local area agency on aging. These resources are listed in both English and Spanish. The county offers food and medical assistance. If you search online for PEAK, P-E-A-K, you can apply online for this assistance. The county has an integrated food task force that's been working collaboratively with all of the local food pantries. The county is working on utilizing the federal CARES funds that Commissioner Szabo just spoke about for a bulk food purchase to keep our pantries full, and the food banks across the county are open to anyone in need. We have the ability to use these CARES funds to provide more support for rent and utilities through our nonprofit partners or the Human Services Department. Again, if you go to www.jeffco.us/community-resources, you will find many different ways to get help. Jeffco Public Health also has a Spanish-speaking phone line to call for questions and answers in Spanish. The phone number for the Spanish line is 720-507-7079. Thank you so much. I will now turn this over to our Community and Workforce Development Director, Kat Douglas.
Thank you, Mary. I'm Kat Douglas. We know that COVID-19 has had many impacts on the businesses in our community. Jefferson County's Business and Workforce Center website is here to help both job seekers and businesses. You can find that website at www.jeffco.us/business-workforce-center. There is so much information out there, including topics like business economic injury disaster loans, the Business Paycheck Protection Program, and alternatives for companies who are considering a layoff. The Business and Workforce Center is also anticipating funding next month to support our emergency relief and recovery partners with staffing, PPE, childcare, and other related expenses. Our website will continue to be the best place to get future updates on the relief support opportunities for the business community. We also know that many of you have lost jobs, been furloughed, or are just concerned about that happening. On the same Business and Workforce Center website, we have job search assistance, including appointments with career specialists and coaches, resources for laid off or furloughed employees, general unemployment insurance information, information about stimulus payments for individuals, and schedules for instructor-led virtual workshops for job seekers. With the reopening of county buildings on June 1, and because of the continuing safety guidelines around the number of individuals who can gather in one area, most workforce, career development, and business services will continue to be provided virtually through the appointment system on our website and or through our call center. Limited services will be provided on site for those that need them, including computer access for public use, phones, and copy machines. Again, you can find our website with all of this information at www.jeffco.us/business-workforce-center. Now I'll turn it over to Amy Miller, Senior Services Manager at Jefferson Center.
Hello. Thank you so much, Kat. Yes, my name is Amy Miller, and I'm a licensed clinical social worker at Jefferson Center. And taking care of our mental health is a critical part of persevering through and recovering from this COVID crisis. We at Jefferson Center know people can survive and even thrive during the most challenging of times. In the field of mental health, we call this resiliency. Resiliency means using the skills and resources we have within ourselves and in our community to navigate and adapt to significant sources of stress. The most important resource when it comes to resiliency? The caring and supportive relationships we have with others. Now more than ever, it's critical that we lean on each other and support one another, because that is what is going to get us through this. If you are someone who is more isolated, there are resources to connect. Agencies are providing check-in calls. The library is offering call-in programs. At Jefferson Center, we have kind, caring therapists who can connect with you and offer that support. Please do not hesitate to reach out if you need support during this time. You can call us at 303-425-0300, and our crisis line is available 24/7 at 844-493-8255. This is a time unlike any other, and you don't have to navigate it alone. Part of supporting recovery is getting the appropriate support during the crisis. Finally, I'd encourage us all to take the opportunity to look deeper at what we've learned over the past couple of months. It's unlikely that we'll ever go totally back to normal, and that's not really what recovery is about. Recovery is about understanding what happened, learning new skills to cope with the challenge, and bringing that knowledge with you into the new reality that lies ahead. So I encourage you to think about what this experience has taught you. Perhaps you have a newfound appreciation for the people you rely on, such as grocery store workers, school teachers, or mail carriers. Maybe it's a newfound appreciation for the relationships in your life. It could be as simple as the realization that we are incredibly interconnected with one another all around the world. Take this time to notice what you are missing and acknowledge the loss. Journaling is a great way not only to process your emotions now, but to also have something to look back on and help you remember these new insights. Envision who and how you want to be at the end of this, and let that vision guide your actions. Because it is remembering what these challenging times have taught us and taking that wisdom forward that will truly build our resiliency. Thank you.
All right, thank you. So we're going to get back to questions. We have a lot of folks in the queue, so I'm going to ask everyone to please be concise with your question, and our panelists will be concise on answering so we can get through as many folks as possible. First up is Jay. Go right ahead with your question.
Yeah, hi. I own a small fitness center, fitness studio in the Ken Carroll area, and we are still forced to be closed after the state safer at home order for over 2 months now. Has Jeffco requested a variance from the state to allow small businesses to open safely with social distancing and precautions? Right now we're competing with Douglas County fitness centers, which are open and they're not too far away. Thanks.
Hi, Jay. This is Commissioner Szabo, and you know what? That is a great point that you are making, competing with other entities. And yes, we have our variants almost ready to go, and it will line out things like places of worship, gyms and recreation, outdoor recreation, event centers, different gathering limits for different sizes. We were hoping that the governor would increase the amounts from 10 people to maybe 50 people by now, but he hasn't mentioned it. He has opened up some other things. I know some restaurants have opened up. I've seen Facebook and a lot of people showing their meals of being out and about. And so we are applying for that. And so I guess the best thing at this point would be if you all could ping the governor and Joe Ryan at CDPHE to grant our variance quickly and get us going so that we're not unfairly competing with other counties. Thank you for your question.
Okay, next is Heidi. Go ahead.
Yeah, hi, it's Heidi. My question is basically, when are we going to start opening up some of the retail stores in Jefferson County? I understand that there's been a significant, financial disaster because of this, and I do have sympathy, obviously, for anybody who would ever contract this. But why can't we start a plan where people who are vulnerable, it is really their decision to be self-quarantined, but also maybe opening up those businesses where there can be a time for them to come in and shop and do things they need, but the rest of the population who doesn't have quite the same problem can also proceed to getting back to the normal life.
Who's going to take that?
This is Dr. Johnson. I guess I'll take that one. All of us want to get back to as normal as we can. We still are not sure what the new normal is going to look like, but we are continuing to work both with the State Health Department, with the Governor's Office, and with our economic councils and chambers of commerce here in Jefferson County to try to figure out what are the steps that need to be taken. How do we move forward to allow people again to start going into businesses and businesses to open up in a manner that is, and again, stressed, both safe for those who are working in the shops and the businesses, as well as the clients and customers that are going into them. Right now, we are dependent on the governor and the executive order that he has in place. As he begins to change that, we will certainly take advantage of that. And as Commissioner Szabo mentioned, we are working on putting together a request for variance for Jefferson County, again, to try to do what we think is best for Jefferson County in ways that may be different than it is for other places in the state. And we will hopefully get that variance into him within this week, and we'll hear back soon as to whether or not the variance is granted or what the parameters of the variance might be. As I also mentioned, eventually it's going to be turned over to the locals, and then we'll be able to do more surgical examining instead of just sort of blunt force looking at everything in a particular industry or business, but look at each individual business and industry and say, here are the things that are unique, here are the things that are strengths or weaknesses in your plan, and work with them to hopefully get things opened up again. Thank you.
And right. Dr. Johnson, can I just say one thing on that? There is nothing more that the county and the commissioners want to do but get our businesses going, and that's why we're making our variance comprehensive and making sure we make, everybody who wants their industry, and I only named a few of them that are in that, and we know how important it is to the livelihood of our citizens and everything that they have done to create these businesses. And that is, one of our goals, our top goals, is keeping everyone safe while opening these businesses up and getting some kind of normalcy back. Thank you.
Thank you, Commissioner. Georgianne is next. Go ahead.
Yes, thank you. I had heard on the TV that they were allowing services and so forth in churches, and some guidelines were mentioned in the newscast. But then when we searched today for guidelines on the governor's website and everywhere else, we couldn't find anything written that would help us to do this if it's possible, and to be law-abiding and take care of our congregation and so forth. And I don't know, maybe they were listening to this. They were talking about a county that has had a variance and ours has not. So can you kind of help me with what you anticipate, or are these guidelines available somewhere that we couldn't find them?
This is Dr. Johnson. Let me answer that one as well as a couple of the other questions that have been asked that are sort of in relation to that. It's an excellent question, and we've been getting that question a lot. But what we have been told is that the governor is expected to come out with some new safer at home guidelines, a new executive order on June 1, and we have been told that the order will address churches, outdoor recreation, swimming pools, and sports. Exactly what all it will include and what the guidelines or the parameters around each of those will be, we don't know. So currently, the official compliance for churches is 10 individuals per room with social distancing. That includes the sanctuaries. So you may have a huge, 4,000 square foot sanctuary, but right now in Jefferson County, it is still limited to what is called a gathering of 10 individuals, which, as I mentioned earlier, doesn't necessarily make sense, and that's why we're working with the commissioners to put together a variance that hopefully will make more sense. Some of the other counties that have gotten variances, and I think it's up to about 25 of them now that have gotten variances, have different parameters, but currently that is what the parameter still is here in Jefferson County, is 10 in a room, which doesn't really matter how big the room is. We still can only have 10 per gathering. Thank you.
All right, thank you, Doctor. Let's take a question from our Spanish simulcast. It came in from Lucy. Lucy asked, are the resources also going to reach people whose documents or legal status is unclear? In reference to the rental assistance, she's asking that question about. Mary or Kat, do you want to take that?
Sure. Thank you for the question, Lucy. This is Mary with Human Services, and I would recommend that anyone who is looking for rental assistance and is Spanish-speaking to contact that number that I referenced. I'll give it to you again. It's 720-507-7079, and I believe they can help you navigate your individual situation to work with a specific nonprofit to help you and your family given what your circumstances are. Another resource potentially can be the statewide 211 number that has lists of resources throughout the state and the metro area. So I would try both of those for rental assistance, and thank you for bringing that to our attention.
Thank you. Elijah is next. Go ahead.
Hi, thank you. Thank you. I'm just kind of curious, what are some of the key KPIs or, success indicators, i.e., like, how is the county measuring the impact of these restrictions, and how are you remaining flexible as the new information comes out, much like the CDC updating the infection fatality ratio from the 3.4% down to the 0.02%, which, is obviously a huge reduction in the threat of COVID-19.
Hi, Elijah. This is Kristine again. If you recall, in the incident commander, I work directly with our team of epidemiologists who are constantly looking at the guidance and the information. And so we try to align both the CDC guidance with what CDPHE is asking us to do and the guidance that they are pushing out, along with the direction from Dr. Johnson as our executive director, and the knowledge of public health science that we have built through years of studying infectious disease. Also, looking at the data that we have in our county. And so starting next week, my hope is that our data epi team, which is expanded, will be able to post new and updated charts on our Jefferson County Public Health website. So I would definitely encourage you to look there as for the data piece that you've mentioned, specific to Jefferson County. As far as the guidance, we look to all three of them. We try to be consistent with our state and neighbor partners as well as our national partners, so that it's not confusing to the public or less confusing to the public if we have different guidance. We certainly don't want to do that. So it's sort of a little bit of everything. I feel like I build a puzzle on a daily basis. And so my hope is that what we have on our Jefferson County Public Health website is reflective of all of those other resources, and you are able to utilize it to the best of your ability.
Okay, Julie, it's your turn. Go right ahead.
Hi, my name's Julie. I manage a doctor's office in Wheat Ridge, and we serve about 8,500 Jefferson County residents. And my question is going to be about the testing recommendations, both PCR as well as the antibody testing. We have lots of calls every day questioning the validity and so forth of the antibody testing, and I'd just like to hear what your recommendations on antibody testing is right now.
All right, this is Dr. Johnson. Thank you, Julie, for that question, and thank you for your work on the front lines of all of this, too. As you mentioned in your question, there are two different types of testing. One is called molecular testing, which is basically the PCR testing that you mentioned. That is the one that people have seen where you put a probe all the way back up in the nasopharynx area and hopefully get enough material out so that you can find the viral particles. That is really the test for diagnosing whether somebody has infection right now. The other test that you're talking about is the antibody test. That's a blood test where you take either a finger stick or a draw blood, and you look in the blood for antibodies against the disease. That test is not good for diagnosing whether you currently have the disease or not. Excuse me. What that test does is it tells you if you have been exposed to the virus in the past at some time, and there are two different kinds of antibodies that tell you how recently you may have been exposed, but it is not a good test for diagnosing. So the PCR test is good for diagnosing. The antibody test is one that tells you whether you've been exposed. It really isn't that helpful yet to do antibody testing because there are a number of different antibody tests out there, and as you mentioned, some of them are more reliable than others. We're still trying to get those that are the FDA-approved tests in the area so that we feel more comfortable with the credibility of the test. And then the way we would use an antibody test is really to do what's called seroprevalence, to see, like with healthcare workers, using it in a group like that and doing testing to see how many of our healthcare workers have been exposed, even though they may not know it, or in a population, look at the whole population of Jefferson County if we possibly could, which we won't be able to, but to look at how many people have been exposed. One of the problems with the tests that are out there right now is they have not been validated by the FDA on some of those, and so some of them are cross-reacting with other coronaviruses, such as the common cold viruses, so we really don't know for sure on a lot of those how specific they are or how sensitive they are, and we also don't know yet how long your immunity lasts, even if you do have a good test and it tells you that you have antibodies. So using it for like a ticket to go to work or a ticket to take a trip or whatever really isn't, we don't know enough yet about the antibodies. So right now, use the PCR test for diagnosing the disease. At this point, the antibody test really is not that useful unless you are studying the seroprevalence in a group of people at this time. Thank you.
All right, thank you. Chris is next. Go ahead.
Good evening. First, I just want to say thank you to Commissioner Szabo and Dr. Johnson and the remaining leaders there for the excellent efforts. Seemingly, Jefferson County was pretty much spared devastation. So thank you for your leadership and quick reaction. My question was really around KPIs, which was just asked. So I'm going to pivot and ask on the variance application. I've heard a couple things that it seemed like Commissioner Szabo seemed to indicate that the variance was complete and ready to be submitted, but Dr. Johnson keeps indicating that we're working on a variance. So I was kind of just hoping for clarification where that's at. and when we could expect results on that. Thank you.
So, Chris, the variance part of ours is complete. There's a lot of outside information the state is asking for, and we have to wait until those entities, the hospital and different entities, that the information that goes along with the variance so that they can actually do the application all together with all the information together. And I'm not sure at this point when all that information is going to. We wanted to get it out yesterday and then today, and so we're working feverishly. I'm sure our attorney, who is working night and day on getting that information and getting it out. We want to do it as soon as possible. So it's not just us or one person working on it. We also have a lot of different entities that need to give us input. And I know, I don't know what your line of work is. Sometimes getting them to respond is not always the quickest way. Dr. Johnson, I don't know if you want to follow up on that or.
No, I think what you said is exactly right, and I know that at this moment our county attorney is working on it because she's been sending me texts asking questions, so we are working on it as hard as we can to get that in. Thank you.
All right, well, Dr. Johnson, before you, we don't have any time. We're just about out of time for questions, so we are sorry if we didn't get to your question, but I do want to ask Dr. Johnson to make some final remarks.
Thank you very much, Roger. I want to first of all thank all of you who have called in for the excellent questions that you have, the obvious interest that you have in Jefferson County and keeping Jefferson County safe, both health-wise and economically. Thank you very much for all you're doing and for all that you, I know, have been troubled during this time. Unfortunately, this is a virus. This is not something that we can see and we can address easily. It's a virus that is novel, one that we have not yet determined exactly how it works, and we're still working on that. So thank you for your patience as we try to work through some of these things. I'd also like to thank Commissioner Szabo and the other members of the panel for taking time tonight to help answer these questions and do some education about what are the resources that are available here. And then finally, thank Roger and the staff for helping us with this call. Please do all you can to keep safe. Please remember, going back to Sue's question, the first question, that there are people in the community that really do need extra help, so that what you can do to help keep socially distanced and using a face covering to help those in our community who are more vulnerable, please do that. Thank you very much.
All right, thank you, Doctor. Again, we're sorry if we didn't get to your questions tonight, but just a couple reminders. If you need information about rental assistance, we were asked to repeat that you can find that at 211. And also, if you're needing questions or have questions and would like to speak to someone in Spanish, you can contact the Adelante Network's community line at 720-507-07. I'm sorry, 720-507-7079. 720-507-7079. On behalf of Jefferson County Public Health and all of our panel, thank you very much for participating. And one last thing, you can leave a message. If you have thought of something else, just stay on the line. You'll be directed to a voicemail system. So lots of ways to get your questions answered. Have a good night and stay healthy, everyone. Thank you very much.